Welcome to Thinking Green. I'm Rana, and tonight we're going to depart a little bit from our usual format and have a show with two separate segments, and the community calendar will be in the middle. So it shouldn't make a huge difference to all of you, but just wanted to warn you. Joining me tonight for the first half of the show is Ann Pratt, who is Director of Organizing for Connecticut Citizens Action Group. And she's been working in Southeast Connecticut. And, well, she has a few subjects to talk about. But anyway, welcome, Ann.
Thank you. Thank you. It's nice to be here.
And there was a newspaper article last Saturday about Governor Malloy putting a halt, or at least a temporary stop, to a planned hospital merger. And I suspect that a lot of people in New London who read that said, whoa, I didn't know anything about this. So why don't you give a little background about the whole issue, because I know CCAG has been doing organizing around it.
Absolutely. So in December, we joined with 5 other groups to actually release a report on this very issue. Connecticut Citizen Action, Service Employees International, a couple of faith organizations, Unite Here. We also came together and said, really, let's take a look at what's going on in Connecticut with the consolidation of some of the hospital industries throughout the state, really. And I think that one of the stunning things to us when we looked at this report was specifically when you look at Yale New Haven Hospital and its move towards consolidating with other hospitals, buying up St. Raphael's and New Haven, Greenwich Hospital, Bridgeport Hospital. The control of the market share is fairly significant, and we just wanted to break that down. What does that really look like? How much market share is it really controlling? And then when you also compare that and contrast that with the fact that in 1995, Connecticut really had all independently owned hospitals. So you take that from a historical perspective and you say, wow, 1995 we had all community-run, nonprofit, independent hospitals. And now, if you look at the landscape, according to this report, 80% of patients go through about 3 or 4 very profitable, large hospital systems. So we have some very big concerns about that. So that was kind of how we started off by taking a look at this. The other history to our involvement, we were also very involved in the fight that was going on around Wyndham Community Hospital. I don't know if people in the London area really heard about that at all.
We wouldn't count on it because I haven't heard that much about it.
Yeah, no, this was very important to us because Hartford Healthcare System bought Wyndham Hospital about 5 years ago. And what's important to stress about that is that the Hartford Healthcare System said, this is, reminds me a little bit of what's going on in our presidential election, this is going to be great.
Well, it's actually happened on so many levels in so many different markets.
Yes, absolutely, it just is. And so they bought it, saying, and Wyndham Hospital was actually struggling financially at the time that they bought it. Although they were in the black, but they were struggling, that they weren't doing as well as they wanted. So Hartford Hospital bought it, and they said, nothing's going to change. It'll be great. It'll be more efficient. Everything will be fine. And then slowly, some of the communities saw that some of the patients were actually being consistently transported to Hartford Hospital, and there was a change in services. And then just in December, it was announced that Hartford Hospital was going to close a very important service at the emergency room and really change the way that the hospital was delivering service. And this was a huge issue within the community because you're going to close some very acute services. You're going to have a lack of service, while at the same time more and more services are being moved to Hartford. And that's a huge burden on a community that's already medically underserved to start with. And so we believe that, number one, that was not a good community-centered healthcare move in that way by Hartford Healthcare system. And also the state they could have actually said there should be a certificate of need hearing on this. If you're going to change the service at Wyndham Hospital, you should have a public hearing, and then the community could have some sort of say. And that's what we were mostly interested in, is if there's going to be a change in the services, what about the community? How does that impact the community? There should be something that's publicly transparent in a public hearing, and that didn't happen.
Now, was this the first of those big mergers to happen in Connecticut?
Big mergers had been kind of marching along, and this was just one of the many, and it just came out as a huge issue for the community in terms of service, and also there's concern about price. So many of those issues have come up. And then consequently, when Yale New Haven has indicated their interest, and L&M Hospital down here have interest in coming together, it seemed like there was too many corollaries of what was going on in Wyndham, and so we really wanted to slow the process down. And we are concerned, and people in the community need to be asking questions: is what will that do to price? If Yale controls all that market, what does that do to price? And what does that do to access, and how will those two things change? And we were arguing to the Office of Healthcare Access that they should do a study. We don't really know what Yale New Haven's actions up until this point have produced in terms of changes of prices. And Yale New Haven indicated that they didn't have those records, or that there was, after 10 years, they do somehow. I'm not quite sure what happens, but there was an argument that says that we don't have that, and Office of Healthcare Access says, well, actually we want to stop this movement and we want to take a look, which was great. I mean, that was a huge step. They said, we need to figure out if have the prices been impacted, has access been impacted. So they put a hold on that in, I think, December, or just recently. And then, as you noted, the governor comes out and says, not only are we going to do the price analysis, we're going to put a hold on the whole process. So it's actually, we believe, a very important, valuable, and a good policy move for the state of Connecticut, because we just have a lot of questions. It might be good, but we don't know that.
Well, I think some people in Southeast Connecticut remember when Lawrence Memorial took over Westerly Hospital, and it didn't impact us in New London so much, but we heard Pawcatuck is not that far, and Westerly are not that far away, and many of the OBGYN services were transferred to New London, and there was a population in Pawcatuck. It is not really an affluent town, and it was a hardship for people to go from a hospital right in their neighborhood, albeit across the border, to have to drive half an hour to come to New London.
Absolutely, absolutely. And that actually has come up when we've done some outreach. I actually spoke at a senior center up in North Stonington, and many of the people actually use Westerly Hospital and talked about the decline in some of the services, and the fear that that was going to change even more with this new takeover by Yale New Haven.
So you've given some of the background. So what other impacts do you anticipate could happen if this proceeds without a lot of thought?
I think one of the things that there is concerned about is what happens to the workforce. There's certainly some questions as to what happens when a hospital comes and takes over, and what changes might be there in terms of that workforce. So, and that's important. That another part of our agenda at Connecticut Citizen Action Group is to make sure that people have good, solid jobs, and that those exist in the community. So that's certainly a thing that's important to us. And looking again at what happened when there were some changes in hospitals in the New Haven area. I'm going to back up and say we're having a community forum, and we will have some people from New Haven who've been through this process. So I think the thing that is most concerned is that, again, from the Wyndham experience and from the experience in New Haven, sometimes things are said like everything is going to stay the same, or nothing's going to change, or there won't be any change in services, or there won't be any change in prices, and then a couple years down the road, whoops, well, actually, things have changed. So part of what the concern is what are the assurances by the hospital that things aren't going to change? And that's really important, I think, for the community to be clear about what does this really mean. And I think significantly is that that there hasn't been we believe, an honest dialogue of what could happen. Certainly there are people who say everything's going to be great and everything's going to be fine, and we just have some concerns and some questions, based upon what happened in Wyndham and also in New Haven.
Even Ronald Reagan said, "Trust but verify."
Thank you very much. Right, and it's really important to look at what, it's important to listen to what people say, but more importantly, it's to watch what they do. And so if one says something and then they do something different, and there have been some examples in New Haven where there have been some issues with some jobs changing and how that impacts the workforce. And there was some practices that people were concerned about in New Haven in terms of very aggressive debt collection that Yale New Haven did. So when there were, a lot of charges that came up from various practices, like if a patient went to a hospital and the hospital went, a certain healthcare site or another doctor, then they were being charged a lot for that. And these are people who, either didn't have insurance or who have very little money. And Yale was a little bit aggressive, not a little bit, but they were very aggressive in how they went around that debt. And there was a lot of work to fix that, and I think Yale has done some things that have fixed that. But again, we want to make sure that the community is fully informed of what can happen and what has happened in other places. And another piece that's important is, what does the community want out of a community hospital? Does that ever happen? Do we ever ask those questions?
No, in fact, even without the consolidation issue, it seems as though the field of nonprofit hospitals is being run more and more like for-profit businesses.
Absolutely. I mean, one of the things when you say what we fear could happen or what we want to study and understand is if there's the consolidation or whatever they're calling, I think they call it the affiliation to L&M Hospital, but the key point here is that Yale will control the board and the decision-making of L&M Hospital. That happened in Wyndham.
And they might not really have much communication at all, good or bad, with the local community.
Right, and whose interests are they serving? It's just a question to ask. The community needs to have the opportunity to ask those questions. So if Yale New Haven does control the L&M board, what does that mean? In whose interests will they be making decisions? And again, I just go back to Wyndham, where the Hartford healthcare system decided that they were going to change the acute care. Even if some people on the Wyndham board felt like that was not a good move and would not serve the community, that decision was made. A couple years down the road, what might stop that from happening, unless there's some sort of assurance by Yale New Haven that they will not change services, or that there is some guarantee that the community's interests and healthcare needs will be served at its fullest rate.
It seems as though we are very often in so many different areas faced with this. Bigger is better. There are economies of scale. We can do more, and that doesn't always work out.
I agree. I mean, that's certainly, if you look at the ways in which industry does that in many ways. And what's that? So the drive, I was just talking with somebody about this just recently, so the drive to get bigger and to control more market share certainly benefits those people who are controlling the market share. However, for consumers or customers, actually, we kind of like the competition, right? It would be great if there were more people competing and the price point goes, that's presumably one of the tenets of capitalism.
Well, and part of the problem is that we saw with the whole banking industry, the whole concept of too big to fail is really a failure of allowing capitalism to work.
That's exactly
among other things.
Exactly.
So why don't you give people details about what the conference is going to be like and how they can get there?
Fantastic, absolutely. So the community forum will be Thursday, March 3rd at Mitchell College in the Weller Center building at the college. And it's 7 o'clock, open to the public. We will be hearing presentations specifically about the monopoly report that we did in terms of the consolidation of the market. And then there will also be a very in-depth and informative conversation of exactly what the governor's commission is proposing and how that might be important for New London and what the impact is on the process. So we'll hear a lot about that. We will have people from Wyndham there who've actually had direct experience with what happened to their hospital and to their healthcare community when Hartford Healthcare changed their system. And then we're going to hear a little bit from the folks here in New London about how this impacts them and some of the concerns. And then we have a great presentation from the New Haven folks, not only in terms of what happened in New Haven, but a lot of what the work has been done in the community, by the community, and for the community to sort of take that in their hands and say, we are a community, this institution serves us, and we want to make sure that it continues to serve us, and they've done an enormous amount of work to help to create a way in which there can be some community benefits to some of the changes that Yale New Haven has done, and some big victories. So we'll have that, and most importantly at the forum is that the community will have an opportunity to tell and to have a conversation about what's important to them. So we want the community to be there to say, I want, or we think this is important in terms of what a community healthcare system should be for the community, and get their voice in this mix.
So even though those of you who are watching might not have heard a lot about it beyond the article in Saturday's paper, which didn't quite say, okay, you can breathe a sigh of relief now, but
in ethics, yes.
In a way it did.
Right.
That it's really still important for those of us who live in New London and the closely surrounding communities to be there.
Absolutely, because this will still happen. There will be, we believe that there will be, the forces are there so that by January 2017, when the process is going to be moving forward, things will be in place so that this process will happen. So the community has now an opportunity to really have some of their authentic voice into this mix.
Now, I don't know if we've talked about this at all yet, but what do you see as Governor Malloy's main rationale for acting so decisively right now?
Great question. Really great question. Well, I think that Governor Malloy, to his credit, has feels that things are happening rather quickly, and they are. And I think that there is a concern, like we have, about really what does all of this consolidation do. And last year there was a great piece of legislation that was passed called Senate Bill 811, which created more transparency, and that hospitals need to have greater transparency in terms of what they're proposing, some of the price information. So I think there's a real desire by the administration's viewpoint to make sure that before decisions are made on, again, transforming another healthcare system, what's going on? What do we need to know? How does this impact price? How does this impact services? What is this going to mean for the market overall? And not rush into decisions. So I think it's just a straightforward good policy to kind of push back, because it is happening very quickly, and there is a shrinkage of the competition that we just spoke of. And what does this mean for healthcare for people all across the head? And that question has not really been asked a whole lot. I mean, I'm sure that some of the hospitals who deliver services have very specific things that they think this is going to help in healthcare, and they will have their voices heard very clearly. But I think there's other voices that need to be had.
And I'm guessing that one of the reasons that there's so much interest in this is that over the last 20 years, hospitalization costs have they've been off the charts.
That's right. And there have been enormous studies done on the disconnect between price and quality. I mean, that's the other piece, is that you can have incredibly high prices and not necessarily good quality. It just is dependent on the region. It depends on, you know, what, it's a very complicated issue, but there's a whole lot of studies that are being done because it doesn't seem to be based on anything that's something that's reasonable or rational sometimes. So it has grown enormously. So.
Now, you've been working on some other issues too, and you touched on the good jobs piece of it. And yes, healthcare jobs usually are good jobs that can't really be outsourced. You have to take care of people where we are.
Exactly.
We can't offshore. But what other kinds of organizing around good jobs in the region has CCAG been doing?
So we've been actively involved in the Fight for 15 campaign and feel like that's been an important movement overall, and we did some work here in Connecticut. Last year we did some interesting work around a study that was done nationally, which highlighted the fact that because large profitable corporations, say like Walmart, McDonald's, whatever, pay their workers very, minimum wage jobs, $9 an hour. We also had a study that demonstrated that if you're going to have a living wage in Connecticut, you really need to be about at $20 an hour to have a living wage in Connecticut. So take that into context, and many people in these large profitable corporations are making $9 an hour. So, and what happens when you have that happen is that they have to use public services, right?
Right, so we're subsidizing the Walmarts of the world.
Exactly. So they get to put their, I think at one point Walmart even had a forum for the Husky application. And so we did a study, and it's something like, $350 million a year that's publicly subsidized. It's a very profitable corporation. So we were saying you have a choice. Either you pay your workers a living wage, $15 an hour would be a good start, or you put money into the state to, pay for the subsidies that we're providing with you. So we did that. It got very far, but it did not actually get signed into legislation. So we are doing that again this year and doing more community work around that. And we feel that that's a huge, and that's actually at this point, we've heard a lot about the deficit and the continuing, this is one of the only revenue bills that we believe is in the mix and will be in the mix. So we're
so even though it's a short session, we might be seeing some movement on that?
Well, it's we will see. It's a big fight, and I don't want to underestimate that fight. The other thing that we also are very interested in and have been looking at is what they did in New Haven, and a lot of organizing went on in New Haven. So that was a long, hard fight, so not to minimize what it takes, but New Haven just recently got a commitment that Yale New Haven and a consortium of businesses will commit to hiring 1,000 residents who live within the city of New Haven. 1,000 residents will be, and some of them from the most disadvantaged communities in New Haven, and there's going to be a whole process. We think that has huge opportunity for people in urban centers that have historically been excluded from jobs. So we're looking at how might we replicate that in places like Eastern Connecticut. We think that that's an interesting strategy.
Well, yeah, it is. Okay, we're down to our last 2 minutes. So maybe tell people again the details if they want to come to the forum on Thursday.
Fantastic. So Thursday, March 3rd, 7 o'clock at Mitchell College at the Weller building at Mitchell College. Open to all people are encouraged. It will be a very informative conversation and lots of dialogue and lots of listening and lots of opportunity for people from the community to have their voice in this mix.
Now, is there a website that people can go to get more info?
Perfect. CCAG.org, www.ccag.org. You can find out there's a lot of information about exactly what's happening and some of the information that I shared with everybody today.
Well, thank you, Anne, for coming on. And I think it's just the start of the conversation. So it may be that in fall we can have an update.
Well, actually, to that point, we are inviting the community back. Again, this is not the last time, so thank you for reminding it, because it does take time. And this will be the very first time that the community has had a chance to even process this information. So thank you very much.
Thanks a lot. Right. And we're going to take a break now, and when we come back, Susan Munger is going to be on talking about what the Master Gardener program is up to this spring. Thanks again.